ES Audio.
From the Evening Standard in London, I'm Rochelle Travers, and this is The Leader.
And we've done your consent.
Yes.
Yeah, you're happy to have your booster dose today?
Yes.
Which arm would you like it in?
This arm.
Okay, do you want to roll up your sleeve for me?
Over the weekend, more than 50,000 COVID-19 vaccines were administered in London, but 42,000 of those were booster jabs. Just 4,000 first doses were given. Coronavirus cases have been rising above 4,000 in the capital for 4 consecutive days. It's thought that 2.7 million people in the city are unvaccinated. Now, one of the UK's top medics has told the Evening Standard the vaccine race must be supercharged. Dr. Vin Diwaka, medical director for the NHS in London, made the appeal as bookings for boosters open to those in their 40s. A top government advisor has also spoken out about the current levels of COVID infections.
I think it is really important that we try to get these levels down because there are people who are unvaccinated for various reasons, and we do need to try and reduce the level of circulation of the virus as well as getting up vaccination rates. No single measure by itself is going to be successful. We need a combination of measures, which includes revaccination, third dose, but also wearing masks and being very careful not to transmit the virus.
Professor Peter Openshaw there, member of NERVTAG, the new and emerging respiratory virus threats advisory group, speaking to BBC Breakfast. The government announced yesterday that a further 61 people had died within 28 days of testing positive for COVID-19. Nicholas Cecil is our political editor and is at Westminster. So, Nicholas, a top UK medic has said that the COVID vaccine race must be supercharged. Who is saying this and why?
This is Dr. Vin Diwaka. He's the medical director for the NHS in London. And he's basically really trying to urge people to come forward for the booster jabs. The reason why this is so important is that the first and second doses of the COVID inoculations, the immunity from them wanes after a while. So while people might think they're protected against the virus, gradually that immunity gets less. The booster has also proved to be highly effective at offering greater protection, and it is more than 90% effective against symptomatic COVID.
Is this just about boosters or also those who've had no COVID vaccine at all?
There's several groups in London that the health chiefs are trying to target. So first of all, they're people who are eligible for the booster. From today, people aged in their 40s can get the booster, can book basically to have it. You can book your jab 5 months after your second dose, and you can get your jab, your booster jab 6 months after your second dose. But there's also quite a large group of people in London who haven't had any vaccinations at all against coronavirus. So estimates range from about 1.2 million to 2.7 million. So this is a large group, and if you haven't been vaccinated, then you're leaving yourself vulnerable to getting the virus and in some cases getting severely ill from it.
What efforts are being made to get these people jabbed?
There are a number of steps being taken here. One is the number of pharmacies in the capital offering boosters and other jabs. That's nearly doubled to more than 260. Another avenue that health chiefs are exploring and developing is basically the idea of hyper-local vaccination venues. So some people were put off getting the vaccines because they had to take the bus or go to a very big centre. So now they're trying to offer it at a very local level. So it might be in your local library, it might be in a shopping centre, or it might even be in a vaccine bus. So making it as easy as possible for people to spend half an hour or a bit of their day getting inoculated.
What are the COVID rates like currently, both nationally and in London specifically?
The latest figures yesterday showed that there were just over 40,000 cases in the UK. In London, there were 4,536 new cases announced yesterday. These are confirmed cases where people have actually tested positive. The real figure is believed to be significantly higher. And for London now, there have been 18,000 or just over 18,000 confirmed cases in the last 4 days. And it's the first time since late July that we've had 4 days on the trot where cases have been over 4,000. So people will be watching these figures very carefully now to see if that signals the start of a rise in cases in London and the disease perhaps spreading further.
People might be listening to this and worrying whether signs are pointing towards that Plan A might be in danger of collapsing.
Well, certainly at the moment, ministers are adamant that there's no evidence to move to Plan B. The case rate in the UK has now been at a consistently high level for a number of months since the restrictions were relaxed. So it's kind of gone up and down a bit, but it's varied probably from about 25,000 to 50,000 or so. So at the moment, the ministers are saying that there's no plan to bring in face masks being compulsory, COVID passports and a return to working from home. But they're not ruling that out.
Many will be thinking, what about Christmas? Should people start to worry about their festive plans?
The message from the government is very much plan your Christmas, but take precautions. So if you're going in a crowded room, particularly with elderly relatives, then wear a mask. These aren't compulsory, but the advice is to wear a mask. Wear a mask when you're on a crowded train as well, or on the tube. So they're saying it's up to individuals to decide what action to take, but they're stressing the need to have some common sense.
And in terms of the bigger picture, Cabinet Minister and former Vaccine Minister Nadim Zahawi has been speaking quite positively about where we're up to with the pandemic, hasn't he?
Mr. Zahawi, speaking on LBC Radio this morning, he was suggesting that Britain will become the first major economy in the world to show how you transition from a pandemic stage of COVID to an endemic stage. And that is a situation where you would get annual vaccination like the flu jab rather than all these restrictions and other measures being taken. So he's basically raising the prospect that next year and in future years we'll have got COVID under such control that it will just be another disease which we need to get ourselves inoculated against. But the pandemic that has caused so much disruption will be over.
And that's it from The Leader. This podcast is back tomorrow at 4 p.m.